AM 1430 KRGI, 105.5 FM. Good morning. I'm Brian Gallagher. We have a pair of guests with us today from Central District Health Department. Fernando Sanchez is here. He's the Health Projects Manager. Welcome back.
Thank you.
And then Journey Noyes is also here. She is the Mental Health Crisis Training Instructor. Welcome. Good to have you here.
Good to be here.
Let's talk about your project because they are going to try to train some folks in the area to help out in their youth mental health first aid effort. And Fernando, I'll let you get started.
Yeah, so to kind of give some background on like how we got here, so we found out we were awarded an AmeriCorps member for 10 months, and so that's Journey. And so there the goal is to train 150 people in the community on responding to youth mental health crisis, which is why we have her. And so we're really excited about it. It's something that she's been really passionate about since her time in college. So it's something that she's done in the past as well. So she has a lot of experience with this. So we're really excited to have her here.
Well, Journey, there's your segue. Tell me, where was your aha moment when you realized this was it?
That's kind of a trick question. I think I've been really interested in mental health since I struggled with mental health back in probably middle school. And I just kind of kept going with it. I didn't really like the way that people talked about mental health, all the stigma surrounding it. So I decided that I wanted to be a counselor and get my master's in that so that I could help people as much as possible. And then, one day I'm just looking for jobs. I just graduated from UNK, so looking for jobs, and I saw AmeriCorps mental health first aid instructor, and I was like, oh my gosh, that sounds amazing. I've taken both of the mental health first aid courses and enjoyed doing that. I was an RA, so I got to use that mental health first aid in action, and I was like, I would love to teach people that. So I applied, and I heard back like instantly, and it just kind of all went from there.
You must enjoy it because your eyes just lit up as soon as you started talking about that.
I love mental health. I love talking about it. I love being that person that people can go to when they know that they need help, but they don't know where to go.
And especially talking to kids. I mean, they're trying to understand things that just happen in day-to-day life. Well, then if there's a complication, I can see some real issues pop up with that. And we've all had our moments where you just kind of go, why am I dealing with this? Why can't I understand it? So I get what you're talking about. But as you now look to try to get folks to help you, who should apply? Who should be interested? Who are the types of folks that you're trying to work with in order to help spread the good news about this?
Anybody who works with youth, who is around youth a lot, if parents wanted to get this training, they could. Anyone. You don't have to have any special credentials. You don't have to be in a specific field. As long as you're passionate on mental health and you want to be that resource for people, you can do mental health first aid training. So right now we're looking for teachers, coaches, social workers, youth group instructors, foster parents, guardians, anyone who works with youth, who's around youth, who wants to make that change.
And I can tell Fernando's into this too, because as she's talking, he's just kind of shaking his head going, yep, that's exactly right.
And I really am, because just yesterday we had a presentation, and then in there we had some results from our community health assessment. And it turns out, so out of like the 50 states and including DC, we rank 49 out of 51 for youth mental health. So we got some work to do, and so just to know that we have an opportunity here to make an impact towards making progress in that aspect, because it's definitely a need. Like, as you can see, like the result shows, like, we're not doing the best in that aspect. So which is why, like, we're really happy to be a part of this process.
So what's next? Are you actively recruiting? And if so, how are you actively recruiting? And if folks are hearing this right now and going, wow, I would like to find out more, I'd like to be involved, what is the next step?
So the next steps would be, for example, right now Journey has been working on identifying those partners that she could collaborate with, and so from there, once we get enough interest, she'll start setting up these sessions, because we only have her for 10 months, so it's limited time. She's already been here for like a month and a half now, so clock's ticking, right? So we have to like get these sessions done, but ultimately, like, once we start getting those people that are interested, we'll start coordinating. And I know Journey has even talked about just being super flexible in meeting people where they're at, and like being able to like have sessions in the weekend as well. So if they would like more information, Journey's email would probably be a good start, or just giving the health department a call and asking for Journey.
And email address?
JNOYES at cdhd.ne.gov.
Okay. It's out there. The information is available. They are looking for people maybe like you. So go ahead and reach out to them directly and see if you can be involved in this. Youth Mental Health First Aid is the project. Fernando Sanchez and Journey Noyes are the ones that are kind of getting it going here on the ground floor. And it sounds like it won't take long. You'll be full speed ahead. But time is of the essence.
That's
so
right.
Go ahead. And the phone number, 385-5175, if you need to visit with them. Okay? Come back and see us again. I'd like a progress report sometime.
do.
Whenever you can squeeze us in. I understand. You're going to be busy. Okay? Good morning from AM 1430 KRGI, 105.5 FM.